This presentation will be about EU-NETVAL validation studies, which were coordinated by EURL ECVAM. We will go over the challenges encountered and proposals for improvement of validation studies. EURL ECVAM has vast experience with validation studies since more than 20 years, and information about all our studies can be found in our tracking system for alternative methods towards regulatory acceptance, known as TSAR. It includes also information and documentation on our EU-NETVAL validation studies. The first study that we conducted with EU-NETVAL involved the CALUX method. This successful study resulted in an OECD test guideline for androgen receptor transactivation assays, TG 458. The second study involved a set of assays to assess the thyroid hormone system disruption. For ease of reference, we will call this the thyroid validation study. This study was recently finalized, and results are currently under review by an OECD expert group. First, a few words on EU-NETVAL. EU-NETVAL stands for European Union Network of Laboratories for the Validation of Alternative Methods. This network of expert laboratories was established under Directive 2010/63 on the protection of animals used for scientific purposes, and more specifically under Article 47 of this directive. It stipulates that member states shall identify and nominate suitable specialized laboratories for validation studies. This is EU-NETVAL, and this was achieved in 2013. This article also indicates that the member states shall contribute to development and validation of alternative approaches. This implies that each EU-NETVAL member can ask their member state for support. The term contribute can be interpreted in many different ways by the member states. The level of support can range from organizing meetings to providing financial assistance, as you will see later in this presentation. Article 59 of this directive refers to the national contact points, the NCPs, who are responsible for implementing this directive. Our network has a terms of reference, which describes, for instance, how laboratories were selected. This was done based on predefined eligibility criteria, such as extensive experience in performing in vitro assays, and so on. All facilities were approved by the NCPs. Each activity we carry out with the network is reported to and approved by the NCPs. The TOR also describes the financing model. EU-NETVAL members and the member states are expected to cover the costs. EURL ECVAM supports by coordinating the activity, statistical analysis of data, providing training, the test systems, all chemicals, and the consumables on a case-by-case basis. More information can be found at our website at the link given below. The network currently comprises 33 members from 15 countries in the EU. The breakdown by country is shown in this figure. All facilities have a quality assurance scheme in place. For most labs, this is GLP certification. Few adhere to ISO standards. How was the design of the CALUX validation study? The study was coordinated by us. It involved one single method to be evaluated by 3 laboratories, with the test method developer also participating. An optimization of the SOP was carried out by us in close collaboration with the test method developer. It included completing the SOP and an experimental testing in our labs. The validation process consisted of transferability, reproducibility within and between labs, and predictive capacity. For ease of reference, we will call this Part 1, 2, and 3. GLP studies were requested for Parts 2 and 3. A total of 52 chemicals were tested, divided over the 3 parts as follows: 6 for transferability, 20 for reproducibility, and an additional set of 26 for predictive capacity. There was a validation managed group that consisted of external and internal experts to provide oversight on the study. As mentioned earlier, The laboratories could seek financial support from their member states, and we provided the cell line and all the chemicals. How did we select the chemicals for this study? A list of candidate chemicals was made on the basis of literature searches, QSAR, Tox21 data, and a high-throughput screening in-house, which provided a first idea of the type of response to be expected. A weight of evidence was applied to arrive to a first set of chemicals. Then, we ensured that a validation set of 2 other similar assays were included in view of the test guideline to be drafted. And we compared with the list of AR reference chemicals from ECVAM, which was published in 2017. The criteria to select were as follows: the evidence of being agonist, antagonist, or a chemical with no response, different potencies ranging from high, medium to weak, a diversity in chemical properties and also in the chemical space, the commercial availability and the cost, the solubility was tested upfront, and 1 chemical was included to challenge the test system for crosstalk with the glucocorticoids receptor. And in the end, we chose a set that was balanced in number for agonist, antagonist, and the chemicals with no response. Coding of the chemicals was performed for those tested in part 2 and 3, and decoding happened at the end of the study when all data were received and the data analysis was finalized. For supplier identification and shipment, I like to refer to the presentation of my colleague. What were the funding challenges with this study? The 3 EU-NETVAL labs all requested funding with their member state, and 2 of the 3 received funds. This figure shows the budget source and how it covered the study cost. Lab 1 and 2 received funds, indicated in blue, and for Lab 1 the study was covered for 100%, but for Lab 2 much less. Own budget had to be used, as indicated here in gray, for Lab 2 and Lab 3. This figure shows the amount of funding received, which was about €500,000 for Lab 1 and much less for Lab 2. Both labs were from different member states. Support from EURL ECVAM consisted of supplying the chemicals, the test system, and the coordination of the study, which consisted of 1 full-time equivalent, FTE, per year, for about 6 years. This time period included also the optimization of the SOP carried out by us. What were the organizational challenges? This figure illustrates the issues reported by the laboratories and also the method developer who joined the study at a later stage in the process. The issues reported were personnel changes for 3 of the 4 labs, although handled efficiently. Limited or no external budget reported by 3 laboratories. Interruptions of the study due to prioritization of other projects. And for 1 lab, the implementation of the method was long and significantly impaired their study's time frame. The main organizational challenge for EURL ECVAM was the impact on the study progress. 2 of the 4 laboratories experienced interruptions, and this on more than 1 occasion, due to services to be provided to the clients. This led to delays and started to create a significant shift in our timeline. Our solution to bringing the study to an end was to do adapt the validation design by reducing the numbers of chemicals to test for the labs that had experienced delays. Labs 2 and 3 performed only part 1 and 2, and also Lab 4, who joined later. In this manner, all labs could finalize the study at about the same time. The lab that performed the study in a timely manner and was able to complete the entire study was the one that had received 100% external funding. What were the factors that led to success of this study and what can be improved? This will be shared at the end of this presentation. I give the floor now to my colleague.
The thyroid validation study was also coordinated by us and performed together with our NETVAL laboratories. 15 of the laboratories agreed to implement and assess in total 18 methods in 2 experimental parts. There was 1 laboratory per method and 2 laboratories worked on 2 methods. Part 1 was aimed at the definition of the in vitro methods and the development of SOPs, and then the robustness and reliability of the methods was assessed experimentally by testing as a minimum the reference and control chemicals of the methods and sometimes a few additional chemicals. In Part 1 there were in total 2 to 7 chemicals tested per method. The aim of Part 2 was to determine the relevance of the methods based on the underlying mechanisms, and the same set of 30 selected chemicals were tested blind-coded in all the methods. A validation management group composed of EURL ECVAM colleagues was overseeing the validation study, and coaches with scientific background were appointed to follow specific mechanistic methods. The EU-NETVAL labs needed to request funding to their member states, and EURL ECVAM provided the usual support. To select 30 chemicals that were relevant for the different mechanisms of action of thyroid disruption, we applied the following criteria. We received advice from thyroid experts with in vitro, in vivo or epidemiological backgrounds, and we considered data from others, such as from the TOX21 database, and we ensured that for each selected chemical there was also evidence of the mechanistic effect in literature. We ensured that within the chemical set there would be at least 2 chemicals active in each method and 2 chemicals that would be inactive in all the methods. And we also ensured a good distribution of all the chemicals in the chemical space, that we confirmed the solubility and that there was a commercial availability, and we also considered the cost. Criteria for the selection of suppliers were the cost differences, which could differ considerably for some of the chemicals, and we ensured the supplier provided sufficient information on their certificates of analysis to be able to identify the chemical and know its purity. Coding and distribution of the chemicals was done as follows. For Part 1 the chemicals were not coded, but for Part 2 the chemicals were aliquoted in small quantities, and then they were coded as such that each laboratory received its own unique code. The chemicals were shipped by express mail, mostly at room temperature, which was the same as done by the suppliers, and only when the review of the data was complete and there was a decision about the activity of the chemicals, they were decoded by EURL ECVAM. We consulted with the 15 EU-NETVAL laboratories that participated in the thyroid validation study to know if they received funding and what were their main challenges during the study. And we received a reply from 10 laboratories. In this pie chart, in the grey part, you see that 50% of the laboratories did not request funding but used their own budget. The other 5 laboratories requested funding to the member state governmental bodies, but only 3 labs actually received it. One laboratory that was funded received €525,000 from the government, and another laboratory used €480,000 from its own budget. So these figures, it's important to know that these figures also covered the necessary method optimization and all expenses, including also personnel for 3 years of work. And we don't really know if these figures are representative for all the methods, but it's the limited amount of information that we have at the moment. And we as coordinator also had expenses, and we spent around €420,000 in the course of the validation study. And of course, for the preparation and coordination work, we had to make available sufficient personnel, and we estimate that we allocated on an average 2.2 full-time personnel per year to the validation study. And we had a peak of workload really when the laboratories started testing, and then we think that we needed around 4 full-time personnel per year. So as you can see in this graph, in the beginning and in the end you need a bit less personnel, but in the middle, when laboratories start testing, there is really a peak of workload. The main organizational challenges that the EU-NETVAL laboratories faced are presented in this bar graph. So all 10 labs, they indicated that method optimization was needed and that it took really more effort than expected. 9 laboratories, they had changes in personnel which required additional training. And 8 laboratories said that they had to prioritize other activities for paying clients during the validation study. 7 laboratories thought that the workload was higher than expected, and 5 laboratories reported that there was a lack of budget. And also some other issues were reported by less laboratories. And of course, we also had the COVID pandemic in the middle of our validation study, which was disturbing really the activities of the laboratories as well. So all these issues, they led to delays or interruptions of the validation work. Challenges for us, they were that especially the amount of communications with more than 35 partners, and to ensure that all the colleagues involved, they gave the same messages to all the laboratories. And we would have liked to have also had more time to harmonize certain step-in procedures of similar methods. And it was also a challenge that timelines of the studies could not be met. The solutions we found for the organizational challenges were twofold. To improve harmonization between the methods, we provided guidance for study planning, for reporting, for sub-writing, and we created also a list with frequently asked questions that we shared with all the laboratories. To keep the timelines and the workload for us and for the EU-NETVAL laboratories reasonable, we also proposed to some laboratories to reduce the amount of chemicals or the amount of runs for the inactive chemicals. So here in this figure, you see how the amount of data was reduced during part 1. You see that with the blue bars, or during part 2 with the orange bars. And reasons to reduce the amount of testing were mainly because the method was either very laborious or the laboratory didn't have sufficient resources to continue to have a good speed, or a combination of both. And you see here on the right, the 2 labs on the right, they implemented 2 methods, and in the end only one of these 2 methods could be continued. So maybe we could conclude that implementation of 2 methods at the same time was maybe a bit much. In our validation studies, we saw that the following factors were contributing to the success of the studies, and when these factors were not in place, that there were either delays or interruptions, or not full data sets could be produced. The SOPs were ready for transfer, and there was no need for optimization. The laboratory had a dedicated budget for the study. The method developer was available to give support, which was especially needed during implementation. The laboratories were strongly committed to finalize the work, and we worked with laboratories that implemented NAMs on a regular basis. There was always a VMG to resolve issues during the study and take certain decisions. And we facilitated knowledge sharing between EU-NETVAL labs, but also with external experts. And finally, we promoted also the application of GIVIM during the implementation and the optimization of the methods. We have some proposals to improve the validation process, which are directed at coordination teams and laboratories. So to improve the validation process, we propose that the coordinator should clarify and preferably ensure method readiness, which means that SOPs should be available that are really ready for transfer. The coordinator should also provide an estimate of the cost, the time and the workload to perform the method, so that laboratories can better judge what the work really entails. The coordinator should also ensure that there is contact with the method developer and minimize the documentation workload for the laboratories. And then the coordinator should finally also properly design and plan the study for a common understanding of expectations. Then we think that it's important for the laboratories that they are well equipped and have the expertise to perform the method that they will validate. They need dedicated time, personnel and equipment to perform the requested studies within the set timelines. and laboratories need a dedicated budget for the study, which can either be their own budget or derived from funding. And furthermore, the labs should need also to be flexible to adjust the planning and allocate more time or personnel if needed. We also have some proposals to hopefully increase the amount of funding for validation. We know that commercial companies are unlikely to invest in NAMs for which there are no regulatory requirements, and that when there are regulatory requirements, there is also the funding for their validation. So to get more funding for validation studies, we believe that regulatory requirements that embrace the use of NAMs are needed. Member countries should establish funding strategies and commit to more funding of validation studies. And in the short term, we need access to public funds for validation, while there are not yet the regulatory requirements for NAMs. And in the mid to long term, we need public-private partnerships. We also see that when laboratories participated in more validation studies, the process is going smoother because they know better what is expected. And therefore, it would be good to establish networks of validation laboratories that are specialized in validation and application of GIVIMP. And these should hopefully increase confidence and attract funding. And finally, when there is funding, it's good to always keep some budget as a reserve for unforeseen additional costs. We hope that this presentation has given some further insights or is complementary to maybe your own thoughts, and we look forward to discuss further during the workshop. Thank you.